I'm Dr. Eric Bracelet. I'm your clinic director at ELC, and today we are going to talk about your cervical roll. So, if you were given a cervical roll, then we're going to give you some tips and tricks on how to use it. This is an awesome piece of equipment that you can use to help restore the curvature or give you that curvature back in your neck here. So when you first get one, yours is going to be all wrapped up and brand new, just like this. And so one of the first things you're going to do is unwrap it, and it comes in a large size already. And so if you come in here, you can actually see that it has these pre-slits, right, just like that. And so the doctor will let you know to take either one or two of them off. If you don't know, what I want to have you do is try it in the large size first, or take off one. Majority of people will either be in the large or the medium size, and so you get to the medium size just by ripping off this bottom half. Really easy, will come off, and it makes it obviously shorter. Okay, when we look at it from the side like this, you can see that it's a little bit more steep and then more slope like this. The slope side is going to be going towards your neck, and we'll demonstrate that after. Some tips and tricks and to get the best success of this is that we're going to use this roll one time a day, and your objective is to get between 10 and 20 minutes. So less than 10 minutes doesn't give you the full benefit, and more than 20 also doesn't give you benefit. So that's going to be the range that you want, but you're not going to start off by trying to do 10 minutes that first day. We're going to build up at it, and you're going to start off at 3 minutes for the first day. All right. I always recommend doing this in more of the evening, just because now your body's had time to warm up. More hydration will help with the ligaments. And again, you're going to do it one time a day, preferably on a hard surface. So today we're going to demonstrate this on our table, but we are going to recommend that you guys at home do it on the floor. Now, if the floor is unable to get on that, or you don't feel safe getting up and down off the floor, then you can also do it on a bed or other hard surface. The reason why we just don't really like the bed is that, again, if you lay on it and you get a lot of cushion, you're just not going to get this full result. Now, if we're going to take a look and show this on Emily here, what we're going to do is aim for this rounded part to be right about the center of the neck there, where this flat part like this is going towards her shoulders, and that ideally her head will go up. So again, if we're going back to looking at the sizing of this, if basically when she lays on it, her head's just being more pushed up, it's just too large. And so for most people that are under 6 foot, automatically we're going to recommend a medium. And again, if you don't know which size you are, start with the large and then always ask your doctor and we'll guide you for it. Let's go ahead and get started here. So we're going to go ahead and demonstrate. So you'll put it on the ground, and then Emily's going to go ahead and get in position, and then go ahead and scoot down towards your feet, right? And so you're going to want to see that curvature, and your head is going to want to hang back on that, right? You can see that this curve is, or this apex of this band, this roll is right here in the center of her neck, and she's just in a nice, relaxed, neutral posture. All right. You're going to want to start off at about 3 minutes for the first day and add a minute per day. So if this was her very first day, she would do this and set a timer for 3 minutes and just let her body relax. Okay. The next day you'll go to 4 minutes, 5 minutes, 6 minutes. And I will say that's a pretty aggressive schedule for a lot of people. And so maybe around minute 5 or 6, you're going to find that your neck gets sore. And that's what we're looking for. We want to try to get to that point where you feel sore. And then just like weight training, you're going to stay at that. So if she's sore at 5 minutes, then maybe for the next 2-3 days, she'll be sore at 5 minutes. We're going to keep her there until all of a sudden 5 minutes isn't as sore anymore. Then we get to 6 and 7, you're going to climb your way up to that 10-minute mark. All right. A couple other tips. When she sits up, one thing we're not going to want to do is have her just sit right like that. If you're sitting in an extended position for 3 to 10 minutes, it's going to be a lot of stress on the neck if you just sit right up. So what you'll want to do is roll off, and then you can safely get yourself up from there. It'll just help prevent getting from dizzy or straightening the neck, again, going from that position, coming back up. And then one tip that I always recommend is take this in the morning and put it on your pillow, because what I find is when patients no longer see it, they put it away and it's out of sight, out of mind. So take it, make your bed, put it right on your pillow, and that way when you're done with your day and you're about to go to bed, you can go ahead and grab it and utilize that. I also really like to use this as a meditation time. There's not a lot of moments in our life that we just have to sit for 10 minutes and do nothing. So close your eyes, really relax, trust the process. If you have any questions about the roll, always ask one of the doctors here. If for any reason you feel weird about it or it doesn't feel right, I always say just stop it right there and ask us, and really talk to one of the chiropractors or one of the staff members so that we can get this set up for you. If you have any questions, let us know. Thank you. Until the next video.